Good morning, everybody. Welcome to another Mancoll Minute and a chilly, snowy morning. It's kind of fun to see. Don't see that much in Virginia. So again, continue to get lots of great questions, and we've had a couple come in along the same line, which is about explants or removal of breast implants and what to do about it. If I don't want to put something back in, what will I expect? Legitimate questions, and it's something I actually try and address before I put implants in people, so when that time comes, which it will for virtually everybody with an implant, hopefully decades later, that they're prepared, or at least it's not the first time they hear that their options basically are to remove the implant and to do nothing. And depending on sort of how your body might have changed, which is not an uncommon thing for some women, is their body's just gotten a little bit bigger, a little thicker, that there's actually more fat in their breasts at that point. So some of them have actually a reasonable amount of breast tissue. We take it out and they've got actually more breasts than they ever had before. Or they say, but it's droopy and now we're gonna do a breast lift. And then I have some folks who say, gosh, I really liked having the volume, I just don't wanna have implants. So what I'll recommend is if we take it out and we're not gonna do a lift, I can fat graft within the breast and give folks, another cup size or so, sometimes a little bit more, by just lipoing fat from one place and injecting it in. Or if someone really needs a breast lift, what I'd like to do then is the implant comes out, and I typically will take the capsule, do the lift, let them heal up, and 3 or 4 months later, do the lipo where I remove fat from one place and then put it into the breast and do what's called fat grafting. And when we do that on the back side, we call that a Brazilian butt lift. So the other big question comes up, when we take out the implant, and this is just obviously a simple gel implant, your body will make a scar around it that's called a capsule. And in many cases, I'm going to also remove the capsule just to kind of get that scar tissue out of there and allow things to heal back. I've seen occasions where when you take an implant out, the capsule remains. It should theoretically kind of dissolve and go away without the influence of the implant, but sometimes it doesn't, and you get a chronic fluid collection in there. So whenever feasible, it's not going to create a tremendous amount of extra trauma, I do take the capsules out at the same time. It's all outpatient surgery done in my surgery center in my office, and you go home the same day. Recovery's pretty easy, actually. Most people tell me it was a lot easier than having them put in. So what it really will come down to when folks have to make this decision is, why are you taking them out? You're just tired of them, life's changing, you're worried about implant-related immune problems, worried about maybe a history of lymphoma because of the textured implants, which I don't use anymore, or they just simply, they ruptured, it's time for them to be taken out. You have to decide what you want when it's over. And there are multiple choices depending on if you just want to go with what you have, rework what you have, or take what you have but also get a little more volume out of it. And I guess I didn't mention, some people just simply go back to a new set of implants. Okay, so there's lots of choices, and part of my job is to help figure that out with you, but it also is nice if you come in with some sense of what you want right from the beginning. If you have old implants, or you have implants you're not sure about, have problems with, give me a call. Love to discuss it with you and see what the best path down the road for you is. Have a great weekend. Take care.